Buccal fat removal has rapidly become one of the most talked about cosmetic procedures in recent years, thanks to social media influencers, celebrities, and even casual beauty enthusiasts showing off sharp, sculpted cheekbones that seem to defy genetics. The procedure itself targets the buccal fat pad, small, deep pockets of fat located in the lower part of the cheeks, removing them to create a more defined facial contour. On the surface, it sounds like a quick, almost magical solution for those who want to slim their face without relying on filters or heavy contour makeup. However, while the allure of a permanently chiseled look is powerful, the potential downsides of this trend are far less glamorous and often overlooked until the consequences are irreversible. The surgery is typically performed under local or general anesthesia and involves the surgeon making small incisions inside the mouth to access and remove the buccal fat pads. Once the fat is extracted, the area is sutured, closed. Recovery time can vary from a few days to a couple of weeks, and because the incisions are inside the mouth, there are usually no visible scars. This ease of recovery, paired with the promise of a lifelong change, is part of what drives the surge in demand. But what's often not discussed is that the removal of this fat is permanent, and the results, while initially striking, may not age as gracefully as people hope. One of the most significant hidden dangers of buccal fat removal is the acceleration of the natural aging process. As we age, we lose fat in our faces, which can lead to hollow cheeks and sagging skin. The buccal fat pads act as natural cushions, providing youthful volume. Removing them prematurely can strip the face of this vital structure, making a person appear older far sooner than they would naturally. While the look might be trendy today, in 10 or 20 years, it can result in a drawn, gaunt appearance. That is difficult and often expensive too, correct? Another danger is facial asymmetry. Even the most skilled surgeon cannot guarantee that the exact same amount of fat will be removed from both sides of the face. Sometimes, swelling during recovery can mask uneven results until weeks or months later. Once the swelling subsides, differences in volume can become obvious, creating an imbalanced look that can't be fixed without additional, often invasive procedures. There is also the risk of nerve and muscle damage. The buccal fat pad lies near critical facial nerves that control movement and expression. Accidental injury during surgery can cause numbness, weakness, or even partial paralysis in parts of the face. While rare, these complications can have lasting effects on both appearance and daily function. Infections, excessive swelling, and scarring inside the mouth are other potential risks that patients may not fully consider in the excitement of achieving a celebrity-inspired look. Weight fluctuations add another layer of risk. A person who undergoes buccal fat removal while at a higher weight might enjoy a balanced, slimmed-down face initially, but if they later lose significant weight, the absence of buccal fat can cause their cheeks to appear overly sunken. This can create an unwell or overly tired appearance, making the face seem older than the rest of the body. What makes this trend particularly concerning is the age group most attracted to it. Many patients seeking buccal fat removal are in their early 20s or even late teens, long before natural age-related fat loss begins. These individuals are making a permanent change based on fleeting beauty trends, without fully considering how their faces will evolve over the decades. While the hollow cheek look is fashionable now, beauty standards are notoriously unpredictable, and what's considered desirable today could be the subject of regret tomorrow. For those still interested in facial slimming, there are less invasive options worth exploring. Makeup contouring offers temporary results without any risk. Non-surgical treatments like ultrasound or radiofrequency skin tightening can create a subtle lift without removing any tissue. Even strategic facial exercises, healthy weight management, and improved posture can contribute to a more defined look without the risks associated with surgery. Ultimately, cosmetic procedures should enhance natural beauty, not erase the very features that make a person unique. The decision to undergo buccal fat removal or any permanent procedure should be made with careful thought, extensive research, and the guidance of a board-certified plastic surgeon. A thorough consultation should include a discussion of long-term outcomes, potential complications, and realistic expectations. And most importantly, it's worth remembering that trends fade, but the changes to your face will remain. The safest and most rewarding beauty decisions are those that prioritize health, individuality, and timeless appeal over passing social media fads.